Hello, this is a tutorial to talk about having an opportunity to elongate the spine. A lot of persons have identified that gravity is making the spine have large curves in it. For absorption purposes, our spine is designed to be tall with very small curves in them so that it can take some of the challenges that we have against gravity and keep us buoyant and mobile, if you will. If you experience pain in your arms or pain in your neck, sometimes that's because the nerves of the spinal cord, as they come through the spine, the bone structure, get pinched between the vertebra. So as we try to elongate those, they'll see a reduction in pain and an increase in mobility. So let's take a look at what this might be like. I'm using a 36-inch foam roller. It's a long foam roller. And what I'm going to do is place my whole spine on the foam roller. So my recommendation is to place the tailbone first with very gentle movement towards the foam roller, allowing the whole spine to lay back on the foam roller. The position first is between the pelvic bones. So you have two of them, and then your tailbone is there, and then your spine starts to come in contact with the foam roller. As you gently lay down, position the back of your head on the foam roller, tucking your chin just gently. What you'll notice in this position is that there is a space in the lower back between the foam roller and your body, and a space at your neck between the foam roller and your body. And we're trying to change the depth of that space, so we want it to reduce in size. My first recommendation is be aware of the shoulder, letting this shoulder girdle start to drop towards the ground, allowing the stresses of the day and the typical positions that we are in, looking at computers and our cell phones, moving that back a little. So we're letting those drop towards the ground. In time, those will slowly start to drop more and more. So that's not a fast movement, it's just a slow change. And then as you are on this foam roller, you'll notice that you might need to adjust. So you might need to tip your pelvis a little to allow for that elongation, and possibly readjust your head again for adapting to the elongation as well. My recommendation is to do this for 5 minutes every day for the first week, and as you begin to feel more comfortable, I would like to see you go as far as 20 minutes every day. As you create this habit and you see some improvements, starting to feel less pain and see an increase in mobility, you can start to adjust that time frame. So skipping a day is appropriate. My encouragement is just do this as frequently as you possibly can. It gives the spine a break, if you will. So this is my recommendation to avoid the pain that might be coming into your hands and arms from the cervical spine, as giving the vertebrae a little bit more space in between each of them, which gives more mobility to the spine and less pressure on the nerves that's coming from the spinal cord. Hope that helps.